We get a lot of questions about Medicare. And while I think the Medicare system itself is very simple, there is a lot of confusion that goes along with it. And so I thought we'd highlight how simple Medicare actually is, where the confusion comes in, and the common mistakes that get made. So let's dive in. Medicare itself consists of basically two parts, Medicare Part A and Medicare Part B. When you approach age 65, you're generally going to be automatically entitled to Medicare Part A, both through your working credits towards Social Security and the tax that you paid into the Medicare system. So if you qualify through your work credits, you generally get enrolled automatically in Part A. It comes without an expense. It's not free. You paid into the system. But you don't pay a monthly premium for it going forward. And everyone who's entitled to it automatically is enrolled. So Medicare Part A has a deductible of about $1,676 this year. After that, you're entitled to 60 days in the hospital. Medicare picks up the expense for that. There's a couple of other things that Medicare Part A covers. We'll throw a graphic up for you on the screen. But everyone that has Medicare gets Medicare Part A, and it's provided free of cost. Covers you at the hospital. It's an easy way to think of it. Medicare Part B, you generally have to go and apply for. There is a monthly premium, roughly $185 this year. Part B, if you think about it from an aerial perspective, is covering you at your doctor's office visits. So doctor's visits, certain vaccines, lab work, preventative care, diagnostic imaging, things that happen in a doctor's office generally going to fall under Medicare Part B. You pay that monthly premium. There is a deductible on Medicare Part B, $257. And after you pay that deductible, you're entitled to an 80-20 coinsurance. What does that mean? Well, when you go to the doctor, Medicare is going to pay 80% of your cost, and you're going to be responsible for 20. That's it. Pretty simple. Probably like the insurance that you had before Medicare worked, an 80-20 coinsurance. The one big caveat and the problem with that system, and the reason why people get secondary insurances, which we're going to talk about in a minute, is that there is no cap to what that 20% could look like. And so if you're receiving chemotherapy in a doctor's office and those charges are excessive, you're going to be responsible for 20% without a cap on what you can spend. That becomes problematic. And it leads people to enroll in secondary insurance programs, which I'm sure you've heard of. Medicare Advantage programs on one side and Medicare supplements on the other. And what I want to do is not only dive into what those are, but I want to dive into why one is recommended significantly more than the other, and why some options may not even be put on your plate at all. So let's look at why that happens and what those options are. What the heck even is a Medicare Advantage plan? Well, going all the way back to 2008, when I started in the business, Medicare Advantage plans were positioned to be an alternative to the Medicare supplement, which we will talk about in just a little bit, an original Medicare. And the thinking at that point was not everybody can afford a Medicare supplement. So there has to be a low cost or no cost alternative for people on Medicare to enroll in that will give them private benefits. And so the government contracts with these private insurance companies, and there's a bunch of them. And I'm sure that you get their solicitations in your mailbox and on your phone nonstop every day, just like I do. And I'm not even a Medicare beneficiary.
Do I?
But they pay them about $1,000 a month to privatize your Medicare benefits. And so if you enroll in a Medicare program, Medicare pays that company about $1,000 on your behalf to the company to take your benefits off of their hands. And they additionally pay about a $600 or $700 commission to the agent that enrolls you in those plans. I'll put up a graphic for you here. And so there's big incentive to enroll you now in 2025 in these Medicare Advantage plans. Rewind again back to 2008 and the compensations were comparable. That's no longer the case. There is major financial incentive for agents like me to enroll people like you in Medicare Advantage programs. It's about a 5 times X on the compensation that we receive. And so as someone who does not count on this for their primary business, I'm okay with a lower commission. But the average Medicare agent that is on the street selling these plans is not super educated on what the plans are, A. But those agents are way overcompensated for enrolling you in those plans versus some of the other options. So you may not even hear about those other options because they don't want you to know they exist. I want you to know they exist. My interest is in your retirement, not how much commission I can make off of your Medicare enrollment. And I want you to be my client for 20 years. I don't want you to get pissed next month when your premium is too much for you to pay or when your benefits aren't good enough. Medicare Advantage programs restrict the doctor network in a lot of cases that you can see. And so my fear for my clients in retirement is that they'll enter into a Medicare Advantage program while they're healthy, thinking that it saves them a lot of money up front. Again, a lot of these plans come with no monthly premium. But as they age and as they get sick, and I'm going to show you a study from the American Society of Clinical Oncology that says on a Medicare Advantage program, you're statistically likely to get less care and statistically likely to die faster if you get cancer on a Medicare Advantage program versus traditional Medicare insurance. So as a retirement planner, it is on my shoulders not to worry about how much commission I make off of your Medicare enrollment, but how your health insurance is going to be administered to you in later years. And is that health insurance company going to throw barriers in your way to receiving the care that you think you need? And the answer to that is absolutely. So let's take a look as to why that happened. You enroll in a Medicare Advantage program and you pay nothing for a monthly premium besides your $185 that you pay for Medicare Part B. You agree for that transaction that you are going to adhere to the insurance company's network of doctors. So you get to go to the doctors that they say you can go to, and if you want to go to one outside of that network, in most cases, you're either going to pay significantly higher amounts or you'll be denied payment from your insurance company for seeing that doctor. Now tell me this, in retirement, as you get older, your health generally does what? It declines. That's the evolution of life. Our health generally declines as we get older. And so at 65, you sign up for Medicare, you're healthy, you're vibrant, and you enroll in your Medicare Advantage program. And you're happy to adhere to this network of doctors because you don't really care what doctor you see, because you don't go very often. But fast forward 5, 6, 7 years down the road, you develop some health issues. Medicare supplement companies, which you may want to switch to, now can deny you for underwriting for pre-existing conditions. They couldn't have done that at age 65. We're going to talk about that more in a minute. But you're stuck now on this Medicare Advantage program that you've elected to take over the years. You now have to go through their hoops. You have to go to the doctors that they say you have to go to, not the ones that you want to see. You may want to see a specialized doctor for something that you need specialized care for, but he's not in the network. What do you do now? Well, they probably do have a doctor that does do some of that in their network, and you will have to go see them. I don't love that in retirement. The argument is that Medicare supplement plans are just too expensive, and people on fixed incomes can't afford them. I'm here to dispel that myth. I think what I'm about to lay out is something that most people can afford. It gives them a much higher quality of care, and it allows them to dictate the health insurance that they want, not one that the insurance company says that you can have, and there are no hoops to jump through. Why isn't anybody telling you about this? The commissions on a Medicare Advantage program vary between $600 and $700. The commissions on the product that I'm telling you cap out at about $130. And so if you think that your Medicare agent has your best interest at heart, and they've enrolled you in a Medicare Advantage program without making you aware that other programs are available, then they're thinking with their pocket and not with your health or your care in mind. I encourage you to stay tuned in. We're going to break down what those Medicare supplements look like, what they cover. I'm going to show you some actual claims history of claims being paid, so you have an understanding of what that looks like, how much it costs, and if it makes sense for you. Because ultimately, this boils down to your health care and the way that you receive it. I just want to make sure it's abundantly clear what the options are and what people's motivations might be when they're selling these plans. So we've now taken a look at Medicare Advantage. There are hoops to jump through, and there are benefits to people who cannot afford a Medicare supplement. This is a great option. It caps how much you can be charged, albeit a relatively high cap, but it at least puts a number on what we know our maximum expense can be for our health care for a given year. I've laid out the positives and I've laid out the negatives. Now let's make a comparison. What is a Medicare supplement? Well, it's all in the name. You get original Medicare. That 80-20 coinsurance that I talked about earlier for Medicare Part B, you get that. The Medicare Part A deductible that entitles you to 0 to 60 days in the hospital that we talked about, you get that. But a Medicare supplement is there to pick up a portion of your 20% or a portion of your hospital expenses. And while there used to be plans that have been since retired that covered all of those expenses, there are plans now that cover the majority of them, and I want to highlight one specifically that I feel is very affordable and that covers the majority of what people need covered in their Medicare system. Let's take a look. The Medicare Supplement High Deductible Plan G is one that you will not hear talked about on commercials. You likely will not receive solicitations in your mailbox, and it is the lowest compensation to agents like me in the Medicare market. It's why there aren't a lot of people banging down your door to tell you about it. There's not a lot of people that talk about this in videos. They want to direct you to a Medicare Advantage program because it pays them 4 or 5 or 6 times more than the plan that I'm about to lay out. But the plan that I'm about to lay out is the plan that I have my parents on. It's the plan that I would recommend any Medicare recipient, if they can afford it, choose. And I'm going to lay out the finances of why I feel so strongly about that. The premium on this plan is about $60 a month locally where I live, and it's one of the higher rates that exists in the country. So for the sake of this video, let's assume that the average premium on the Medicare High Deductible Plan G is $50 a month. You pay that in addition to your $170 or $180 that you pay for your Medicare Part B premium. And that Medicare supplement will now entitle you to a Medicare Supplement Plan G after you meet their deductible, which for this year is $2,850. On the surface, may sound like a big number, but I want to break down how we get to that $2,850, what it looks like, and who could benefit and maybe who wouldn't benefit from a plan like this. So the Medicare supplement, you're on original Medicare and you go to the doctor. That doctor's office visit may be $100, maybe $200, maybe $1,000 if we're seeing a specialist. Medicare is going to cover 80% of that cost for you. So a $100 doctor's office visit, Medicare is going to cover $80. You're going to be responsible for $20. That $20 counts towards your deductible on the High Deductible Plan G plan that we've highlighted. You get to go to any doctor in the country that accepts Medicare by law. No company can offer this plan with additional benefits. And so what I tell people is this: a Medicare supplement plan doesn't matter which company you buy it from. It matters which plan you select. And this High Deductible Plan G is the plan that I've selected for the majority of my clients. After they meet the deductible, all of their health care expenses are covered at 100%. My dad, a couple of years ago, had an 8-day hospital stay. I'm going to highlight for you the claim right here. $65,000 was billed. 64 and change was approved by Medicare. My dad's responsibility was $1,400, counted towards his $2,800 deductible on his plan, and he was able to stay in the hospital for 8 days, and all that came out of his pocket was the $1,400. He can go to any hospital in the country that he wants, so long as they accept Medicare. As far as I know, that's all of them, most of them, 99%. And he can go to any doctor that he wants without having to check with the insurance company Is this doctor in my network? Do I have a higher charge if I go see them? None of those things exist in a Medicare supplement program. And so I want to highlight for you again, the main difference and the reason why your agent didn't highlight is because it's significantly more financially in their favor to sign you up for the Medicare Advantage program. And they can justify it. There are good benefits in those plans. It's not like they're hanging you out to dry. But if they haven't laid out for you both sides of this coin, then they're thinking with their pocket and not with your best interest in mind. We're a full-fledged retirement planning firm. I don't only do Medicare. I don't only do Social Security. I don't only do investments. I do all of those things. And in Medicare, if you can afford the premium, the Medicare Supplement program is significantly in your advantage over the Medicare Advantage program. Hopefully we've laid that out. Hopefully you can see here that your care is significantly greater and your quality of life will be significantly greater with a Medicare Supplement program because you don't have to jump through the insurance company's hoops and things can't be changed. One additional piece that I particularly don't care for when it comes to the Medicare Advantage programs is that each year, Medicare says those programs can make major overhauls to their benefits, and your plan may change significantly under your feet and leave you without another option. If your health is deteriorated to the point that you can't qualify medically for a Medicare supplement program, you may be stuck there. And that company can change your benefits any which way that they want. In retirement, I think that people want health care that they can control and get care where they want to get it, not where an insurance company says you can go. Some types of care require specialized treatment. And if your insurance company tells you no, what are you going to do then? Please reach out. Let us provide for you a comparison between the two. We're happy to do it. But if you're stuck in the Medicare rut and you need a little bit of guidance, here it is. Hopefully this helps. Hopefully this clears it up. Hopefully this shines a light on this confusing area of retirement. Thanks.